Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to fix trigger finger pain. And you actually can do that at home. But before I do that, I will go over the normal healing cycle so it will make sense how to treat the root cause of trigger finger. So I'm gonna use an external paper cut as an example for visualization for the normal healing cycle, but the same process happened internally with trigger finger. And as you can see it here, when someone has a trigger finger, you start to have inflammation and scarring. So the first stage of healing is inflammation. So you start to have increased temperature, the blood starts to rush to that area, and you start to have swelling, redness, and pain. Second stage of healing, it's called the proliferation stage. During the stage, there is a cascade of events including fibrotic tissue, building scar tissue here, fascia restriction, muscle spasm, and trigger points. And by definition, trigger finger is inflammation and scarring fibrotic tissue in the tendon, and you see it here, very obvious. In perfect scenario, actually during the maturation stage, your body should get rid of the inflammation and the proliferation and clears everything up. That could take days, weeks, months, or years. For chronic condition, usually if you have trigger finger for a long time, you're probably going back and forth between inflammation and proliferation stage. And you see it in this image when you have a scarring there and inflammation. Why that could be an issue? Because our muscle should act like a rubber band when it contract and relax, stretch like this. So when you have a scarring, it's like you have a knot in a rubber band. So when your muscle contract, it will not stretch much. And that's exactly what happened with trigger finger. When you have fibrotic tissue, that will limit the range of motion of your tendon and actually cause the finger to snap and not fully extend or not fully flexed. So before I go over how to treat the root cause of trigger finger, we need to understand what current treatment that's available and why it's not effective. And actually, I will leave a link underneath this video for the study that indicate those treatments are not effective, and will relate that to the normal healing cycle. So it will make sense that you should not actually waste your time and money on something that does not work. So when we look at the healing cycle, inflammation and proliferation, if you use ice or heat, ice is specifically a temporary decrease inflammation, but it will not do anything to decrease your fibrotic tissue or the fascia restrictions. The other common treatments: stem, foam roller, massage, acupuncture, dry needle, joint mobilization, stretching is actually not very effective, because when we look at the normal healing cycle, you will see stretching, it's actually could cause more inflammation than actually breaking the adhesion. So that can kind of actually make the symptoms worse. Massage, dry needle, and acupuncture will not do much for the inflammation, and actually too much rubbing with the massage could cause more inflammation. Strengthening exercises, so strength is not going to break that adhesion of the fibrotic tissue or decrease the inflammation. But if you and actually that's one of the causes of causing trigger finger is repetitive gripping, repetitive movement. So if you actually do more movement, you're going to make it worse, because it's going to cause more inflammation, more micro tear in that area that will be as a normal part of healing cycle to build fibrotic tissue. Actually, fibrotic tissue is part of normal healing. We want that, because if you have external cut and your body does not build a scar tissue, it's open wound susceptible for infection. So fibrotic tissue, very essential for our survival. The problem is when you have excessive fibrotic tissue, and actually when you have a trigger finger, one of the things to figure out if you have it is actually palpate here, and you will feel a nodula, and that's usually fibrotic tissue. So what I personally do for trigger finger with my patient that's very effective, the first thing I have to work on is inflammation, because by definition is actually trigger finger is inflammation and fibrotic tissue in the tendon. So the first thing I do is, if you have acute stage of trigger finger, rest will be effective if it's resolve the symptoms. So rest mean like avoid the repetitive movement, the typing, the gripping. If you did avoid the movement for 2-3 weeks and your symptoms has not been resolved, that's indicative that you have severe chronic trigger finger. And another way to know it is how severe is the clicking and the pain and the stiffness, and also the size of the fibrotic tissue in this area. So if rest does not resolve it, that's an indicative of chronic inflammation. So we have to break that vicious cycle of inflammation and proliferation. So what I usually do with my patient, I give them the MagnaHeal 2. This is very strong magnet. The range of the magnetic field here is 3 to 4 inches deep that goes inside the body. So that's helped to decrease localized inflammation. So I will have them wear it at night or throughout the day to decrease the swelling in the hand. The second thing I like to do, because that's one of the risk factor, is put my patient on an anti-inflammatory diet. I see it very frequently with my patient that comes for treatment for trigger finger, that one of the triggers that they have is they eat daily inflammatory food. So the anti-inflammatory diet extremely part of the important part of the treatment to address trigger finger properly. So simultaneously, while I'm using the MagnaHeal to decrease the external inflammation, the localized inflammation, internally I put the patient on anti-inflammatory diet to decrease the internal inflammation. And when patients have it really chronic condition for a very long time, that's a sign that they might have vitamins, mineral deficiency that slow down the internal healing cycle. For the body to move normally from inflammation to proliferation to maturation stage, you need vitamin D, magnesium, B, C, and other vitamins and mineral to actually transition from one stage to another stage in the healing cycle. So for chronic condition, I usually like to evaluate their nutrition, their diet, and look intensively in their vitamins and mineral content. So this way we'll make sure there is no internal deficiency that slow down the normal healing cycle. And that's actually the most effective approach for decreasing the inflammation. Very important point. This treatment is very effective only if you implement the 3 elements. So you cannot pick and choose, I'm going to work only on inflammation and I'm not going to address the proliferation stage, that you will get a good result, because by definition trigger finger is inflammation and fibrotic tissue that cause the trigger finger. So you cannot pick and choose, I'm going to work only on the inflammation, or the second cause is the fibrotic tissue, and assume that will be resolved. You have to address those 3 elements simultaneously for best result. So the second treatment is fibrotic tissue, and you see it here in actually normal healing cycle is the scarring. The problem is with trigger finger is excessive scarring, and go ahead and palpate those areas in your finger and you will notice those tendons are inflamed and actually scarred up. So we have to break that adhesion. And you can see in the first image here, that's normal muscle, and when you have a micro tear or tear in the muscle, it's common with trigger finger is with the repetitive strain injury, you start to have a tear like the second image here. When your body starts to build a scar tissue, it builds it actually randomly like this, and you can see it here in this image. So when your body builds excessive scar tissue like this, you start to have a nodule in here in the tendon that actually prevent the tendon from fully elongating. So what I personally do and use with my patient to break down the adhesion or the fibrotic tissue, I use the A3 to break that fibrotic tissue, the superficial fibrotic tissue, and I use actually A5 to go deep enough to break deep adhesion. Simultaneously, I'm doing that while I'm decreasing the inflammation for the best result. The third treatment that's extremely very overlooked is fascia restrictions.
And when we look at the normal healing cycle, you will see fascia restriction is part of the proliferation stage. Next time when you go buy meat, look at that white filament. That is a fascia layer. And we have a lot of different fascia layers. So when we dissect cadaver, you can see the white filament here. That's a fascia layers. And it's very common with trigger finger. When you have fibrotic tissue, your fascia layer in this area and in this area, it's all restricted. So to make things complicated, but don't worry, the treatment very simple. The fascia system divided to two major categories, superficial and deep fascia. And the deep fascia layers divided to four subcategories: aperitic fascia, epimysin, premiysin, and endomysin. So the superficial fascia layer, it's like wrapping the entire body. It's like a Spider-Man suit. So when you have restriction in the fascia layer, it's like you're wearing a t-shirt 2 to 3 size too small. So it's actually compressed on your hand and limited the range of motion. And when you have fibrotic tissue, as that fibrotic tissue is actually adhere or glue those fascia layers together and prevent the muscle from gliding and having enough range of motion to move. So aperitic fascia is a group of fascia layers that wrapping a group of muscles. Then we have the epimysin wrapping each individual muscle fiber, and then we have the premiysin wrapping a bundle of muscle fiber, and finally the endomysin. Each individual muscle fiber is actually wrapped with a fiber. So for trigger finger, we have to release those fascia restrictions, simultaneously releasing that fibrotic tissue and decreasing the inflammation. So what I personally do for releasing the fascia layer, I use the A1 to release superficial and aperitic fascia layer, and I also use the A5 to go deep enough to release the epimysin, premiysin, and endomysin, and I actually release it throughout the muscle. So from the tendon all the way to the muscle attachment to the elbow for best result. As I mentioned to you, this treatment only effective if you address those three elements simultaneously. I will leave a link underneath this video on how to get those tools to release trigger finger. If you have any comment or question, leave it in the comment section and I will answer it in the future video. See you soon.
Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.